A frozen shoulder is a stiff and painful shoulder. It's caused by increased collagen fiber production in the capsule of the shoulder joint. And we don't know exactly why it happens to some people and not to others. There are some well-known risk factors for frozen shoulder though. Frozen shoulder generally occurs in those aged between 40 and 60. It's quite rare in people under 40 and in people over 60. Most of the time in people over 60, a stiff shoulder is caused by osteoarthritis or some other cause. Frozen shoulder occurs 3 times more often in women than it does in men. It often occurs after a period of prolonged immobility, so after an injury or sometimes after surgery when you've been in a sling for a long time and been unable to move the shoulder. And it's also associated with certain systemic disorders such as diabetes and thyroid problems. So there are 3 stages of frozen shoulder. Stage 1, freezing. During this phase, pain is much worse than stiffness. Then into stage 2, when the shoulder is frozen, it becomes more stable and usually stiffness is the main problem. It's still usually painful, but stiffness becomes worse than the pain. And then stage 3, we call the thawing stage, and that's when the shoulder is finally starting to resolve. Frozen shoulder can last anywhere from months to several years. So the good news about frozen shoulder is it always gets better. And there are plenty of treatments that you can undertake to help reduce pain and reduce stiffness and improve your range of motion, because even though they all get better, it is generally a long-lasting problem. So the more comfortable you can be and the more movement you can have during that period of time, the better. So in stage 1 of a frozen shoulder, the best advice is generally to keep moving. There are specific exercises you can do and your physiotherapist can guide you through those. And we know this tends to help. In stage 1, a cortisone injection can also be very, very helpful for reducing pain. As the condition progresses, these injections tend to be less useful. So if you're going to have one, try to get it in the first 4 to 6 weeks. If treatment in stage 2 continues along the same lines with physiotherapy, some manual therapy, joint mobilizations, capsular stretches and things like that can help with pain and range of motion. And there are more advanced exercises we can do, specifically some eccentric loading exercises. These need to be guided by your physiotherapist because they're not for everyone, but they have been shown to significantly increase range of motion during this stage. So that can be very, very useful. Other than that, general lifestyle management, maintaining a healthy diet and normal activity levels has actually been shown to improve frozen shoulder as well. The healthier you are generally, the less likely your frozen shoulder is to last for years and years. Hope you found this video useful. We're going to be doing a lot more posts about frozen shoulder later in the week, including some exercises you can do, some ways we assess and diagnose frozen shoulder and lots of other useful things like that. So if you have any friends or family who have suffered from frozen shoulder, tag them below and let us know if you have any questions. Thanks for watching.